The largest vaccination program in the U.S. is now underway. Hospitals and clinics across the country are now administering coronavirus vaccines. Healthcare workers, Americans over the age of 65, and nursing home residents are first in line. FedEx and UPS are delivering supplies to more than 600 distribution sites across the country. The vaccines are stored in deep freeze containers during transport. This comes as U.S. coronavirus deaths top 300,000. More than 16.4 million cases have been confirmed. More than 109,000 people are hospitalized with COVID-19. Healthcare facilities nationwide are running out of ICU beds, and New York City Mayor Bill de Blasio warns a, quote, full shutdown is on the table. Mola Lenghi is there with more.
At NYU's Langone Health Hospital, it was a shot of relief.
I woke up today, I was thrilled.
Nationwide, frontline workers lined up to get their first dose. Critical care nurse Sandra Lindsay at Long Island Jewish Medical Center got hers just after 9 a.m., making her the first in the country to receive the authorized vaccine.
I hope this marks the beginning to the end of a very painful time in our history.
Across the nation, the first 500,000 doses were delivered and carted into sub-zero freezers. From Madison, Wisconsin,
it's important because so many people have died.
Into the arms of frontline workers at Ochsner Medical Center in Louisiana and Hartford, Connecticut. Some at the University of Pittsburgh Medical Center were overcome with emotion.
I think it was just knowing that finally something has happened good in this year, and I'm going to be the first person to be the recipient of it.
2.9 million Pfizer doses will roll out this week, with an additional 2.9 million next week, and 20 million by the end of the year. It'll take at least 5 weeks for the first phase of vaccinations to be completed.
We have enough vaccines already purchased to ensure we can meet our goal of vaccinating every American who wants it by the end of the second quarter of 2021.
3 million residents in nursing homes were also supposed to start getting their shots. Nearly 40% of COVID deaths have occurred in those facilities. But CBS News has learned that the Trump administration delayed the vaccine to most nursing homes working with the government's pharmacy partners, like CVS, to December 21st due to patient consent issues. But consent was no issue for these doctors and nurses, eager to get vaccinated. For NYU Langone Health's Dr. Tina Wu, today's vaccine is more than just a shot. It's a prescription to get back to normal.
I haven't hugged my mom in a year, and I think that is one thing that I'm so looking forward to.
And that's the first Kentucky vaccination.
I'm Chris Van Cleve in Louisville, Kentucky. The coronavirus vaccine going into the arm of nurse LaShawn Scott marks the end of a journey that started 24 hours earlier.
I know we still have a long road ahead of us, but I can see that light at the end of the tunnel now.
The box of 975 doses of vaccine for the University of Louisville Hospital was among the first 150 to be packed and filled with 50 pounds of dry ice to keep the vials at negative 94 degrees. Then loaded on a semi, and an hour later, on board UPS Flight 3477 to Louisville.
Every package is a person, we always say. In this instance, it's a life-saving vaccine that can make a difference in someone's life.
Those life-saving packages passed through UPS's Worldport sorting facility and were loaded onto overnight flights.
We're launching a very complex nationwide distribution program. There are going to be hitches and hiccups as we go.
The boxes are equipped with GPS and temperature tracking. The entire process is being monitored in real time from UPS's COVID command center.
As soon as that box arrives in this facility or any of our facilities around the country, we can find it within 10 feet.
In Dallas, delivery was personal for driver Paul Peroni. Just 3 weeks ago, he lost a relative to COVID.
It impacts all of us, and so let's let the healing begin.
UPS and FedEx tell us they made their first day of vaccine deliveries on or ahead of schedule and are already filling up planes like this one with Tuesday's round of deliveries. And one of the challenges will be managing expectations. Walgreens had to cancel a vaccination event in Michigan because its batches haven't shipped yet. Elaine?
Chris Van Cleve, thank you. The U.S. has set a record for coronavirus hospitalizations 8 days in a row, and ICUs across the country are reaching capacity. Jonathan Vigliotti has more on the latest surge.
Tonight, the pandemic shattering records and taking lives. In Los Angeles County alone, new COVID cases are up 370% in just 1 month.
With the increasing numbers even several weeks ago, that it was only a matter of time.
Cases have catapulted around California, more than 30,000 per day. In the state's Central Valley, there are no ICU beds left.
A little bit of bruising.
Infectious disease doctor Dana Hawkinson at the University of Kansas Health System is not only juggling an onslaught of new patients, but fewer staffers. Today alone, about 270 employees called out sick, either infected or in quarantine, as other states are calling to transfer another 1,200 patients to his team.
And this is because rural areas, which can be hit hard and have lower resources, just don't have the room or capacity.
New Jersey's governor warns the next few weeks are going to be hell. The state now has the highest COVID death rate in the nation. And a dire warning from New York City Mayor Bill de Blasio. He says a full shutdown may be imminent as cases there continue to spike.
What is increasingly clear is that all forms of restrictions have to be on the table at this point.
Dr. Anthony Fauci says life may not be fully normal again until late next year.
The vaccine right now is not a substitute for the normal standard public health measures of wearing a mask, keeping your distance.
86-year-old David Childress among those who recently lost their battle with COVID. The retired firefighter and father of 5 was able to spend his final moments in the hospital with his wife of 66 years, Judy.
So many families don't get to do that. I was blessed. I was just so blessed.
And as the heartbreak continues, hospitals are dealing with the surge. Here at St. John's in Santa Monica, they're actually building tents like this for COVID patients in their parking lot. Across America tonight, Elaine, millions of Americans live near hospitals that are running out of space.
Jonathan Vigliotti, thank you. For more, let's bring in Dr. Teresa Amato. She's the chair of emergency medicine at Long Island Jewish Forest Hills. Dr. Amato, thank you for being with us. The U.S. has begun vaccinations. New York Governor Andrew Cuomo called it, quote, the beginning of the last chapter of the book. Put this into context for us, Doctor. How big of a step is this in the fight against the virus?
Yeah, today was a good day. Very, very proud to be part of Northwell Health today and to watch the video of one of my colleagues take the first vaccine. There's no words for it. We do say in emergency medicine that there's no crying in baseball, but I'm not going to lie. I definitely got a little teary-eyed today watching it.
What went through your mind?
I was so glad that this day is finally here. I think that there's been so many people working so hard to get this vaccine out in a safe and timely fashion. It is a huge logistic, collaborative work effort. And to see that UPS truck drive up today with the first set of vaccines to my hospital, it was just a really hopeful moment. It's been a very long, dark few months, and I feel like this was really a win. We were really, really excited today to see that.
So let's talk a little bit more about the details. What does this rollout actually look like in hospitals? And what are some of the biggest concerns with respect to that?
So I think every health system has been tasked with really trying to figure out how are they going to roll out these vaccines. Obviously, we don't have enough to vaccinate everybody all at the same time, nor could we do that even if we had all the vaccines here, because we do know that some of the side effects are a little bit of a low-grade fever and maybe some muscle aches and not feeling well. So we certainly wouldn't want anybody coming to work with those symptoms. So we really have to be mindful of how we roll this out so that we have all our employees vaccinating in a proper order to keep our staffing up. But we've looked at, which areas are really hit the hardest by this COVID virus, who has the most exposure. We look at age, we look at what area that you are working in our organization. Are you at a hot spot? And that's how we're really rolling this out. We're sending out emails to staff so that they can get on and make their appointments. And, again, we're just trying to be very mindful, just like every other health system, of how to roll this out to be the most effective.
You mentioned staffers getting vaccinated in the proper order. How else are health officials accounting for those possible side effects of the vaccine, given that staffers are the ones who are on the front lines fighting the virus and, they're the ones who are first to receive it?
Yeah, so I think when you talk to people that are getting the vaccine, I think most of us believe in all the science, and we know that even if you get some mild side effects from this vaccine, it is still by far safer than getting the actual virus. And so I think that even though the side effects are going to last a day or two, I think most of us are happy to go through that knowing that we're going to be protected from getting this virus.
Well, as we mentioned, healthcare workers and nursing home residents are receiving the first doses. Do we have any idea when the rest of the population may be eligible for a vaccine? And what might distribution look like, given how big of an undertaking this initial rollout is proving to be?
So, I mean, if you look in our past, and we've had to do massive vaccinations, you look at like for polio, for instance, Americans have a great capacity to come together and work together when there really is a crisis. I look at what my team did here in our small community site, which was at one point an epicenter of the pandemic, and people did the unimaginable working together. And I see this happening now with the vaccine. You look at all these moving parts, and people are just happy to do it. They want to be involved. They want to get these out. And so I think there's nothing Americans can't do if they work together.
Well, health officials are still urging Americans to continue following coronavirus guidelines. Why is it important, doctor, to keep wearing masks and to socially distance for people who've both been vaccinated and for people who haven't? Is it still possible to be infected even after you've received both doses?
So that's an interesting question. We do know that it's highly effective for you not to get sick once you get the vaccines, for you to actually get sick from the coronavirus. However, we're not sure yet that if you are exposed to the coronavirus, that even if you have the antibodies from the vaccine, are you still able to transmit the virus to someone else? And we don't know that yet. We hope not, but we're not sure. So therefore, I would say let's be mindful and let's take care of especially our older adults and people that are more vulnerable to this virus. So we're very excited for you to get your vaccine, both doses, but we're still going to have to be wearing our mask and socially distancing until we can really get to what we call the herd immunity level, where we know there's enough people either vaccinated or have antibodies that we won't be seeing it getting transmitted so quickly.
All right, Dr. Teresa Amato, really appreciate your expertise. Thank you very much.
Thank you so much. Stay safe.